Good morning and welcome to Health Talk here on AM 1270 and 96.5 FM KXBX. Paul Thomas and Bill Kearney in the studio. Bill from Northlake Medical Pharmacy. And a couple drops of rain I see out there, and I'm going to apologize before we get going here. I don't know what happened, but overnight I developed this like sniffly, runny nose thing that just came on out of nowhere. I was fine yesterday, and today I'm all clogged up and
well, it's there's all kinds of stuff going around right now, and we yesterday we recorded a show for while I'm going to be gone, and I had the same thing yesterday, and I kept coughing, and there are medicines you can take, I guess that, and I shouldn't guess. I know there are medicines you can take that are decongestants and help that, but and I normally because we've had a few critics that say that I cough too much while I'm on the air, so I
snore too much.
Yeah,
there's all kinds.
Well, those were the old days. That's when the chair was more comfortable and you were laying on a cot. It's a little when you're sitting up now. It's a little bit tougher. But we had yesterday was Valentine's Day, and I went home and took my wife some flowers, and I'm sure you did too, also, Paul.
Well, I was in the doghouse before the day even began because I admitted to my wife that I had told the staff here, my coworkers, that I hadn't gotten her Valentine's Day present yet, and she wasn't mad that I didn't get her a present. She was mad that I told the staff that I didn't get her a present. So I had intended to and ended up getting her, something. And so anyway, I was out of the doghouse, but yeah, I guess don't wait till the last minute, or don't admit that you wait till the last minute.
Well, I guess is the moral of the story. I bought some flowers. I didn't have time to go through the florist like I usually do, and so I stopped by Bruno's grocery store, and I got what I thought were a couple of dozen roses, and I thought, gee, these are fairly inexpensive, and I got them home, and they were tulips, not roses, but didn't make any difference.
Tulips are great, actually.
It was the thought. We had a great crab dinner. And
oh, really? We had lobster last night.
Did you really? Yeah.
I wonder if the percentage of, seafood goes up on Valentine's Day, the exotic seafoods.
Well, I don't know. We had lobster for New Year's because we couldn't get any crab.
Yeah.
And it was excellent. We cleaned up and we're in bed about 10:30, and I was still sitting there trying to get asleep about 1 o'clock, and finally I went downstairs and read in my Kindle a little bit to try to finally about 3 o'clock I went to sleep, and then of course 6 o'clock the alarm goes off. So if you hear me snoring over here, it could be that problem.
Yeah,
so,
I know.
But we're going to be talking about, because it's the month of February, a lot about heart disease. And how expensive it is, and how much it affects the rest of your body. We also are. We can never let a day go by without talking about opiate problems. And
I saw the report that sat there on your desk there. The increase in the ODs.
And, just this morning at Louisville, that we'd reported on our recorded show yesterday that there were, I think, 52 overdoses in a weekend. And I'm going there for a board meeting in a month. They had 151 overdoses in 4 days.
Wow. That's just crazy.
Nobody knows. Most of it was from fentanyl. It turns out that there is just a huge epidemic all over the country. After we cut down people on oxycodone, when insurances quit paying and the cost of it went up so high, everybody went on heroin. And during the 3 hours that these crews responded to a bunch of overdoses, many of them probably caused by heroin, but when they arrived at the scene, they began talking with firefighters, and there was suddenly another radio call, and right while they're answering one call, there's another call for an overdose. So you hear some of the stories that about how bad it is, and we we have talked about the price of drugs of going up. Naloxone, which is the drug that stops this, has gone up 450% in just 3 years. So it can be anywhere. The Epic on Louisville, where crews responded to 151 calls about overdoses over a 4-day span, that stressed and strained resources for things that we needed to be here for. One person using heroin was killed while riding in a car that crashed. The overdoses seemingly happened everywhere. Homes, restaurants, parking lots, people slumped in cars, at stoplights. It can be anywhere. At these sites, people armed with naloxone. The city responders revive person after person after person, and then they're out of the naloxone. I myself and 3 of my pharmacists have been certified in dispensing naloxone. The problem is who's going to pay for it. And at the cost that it is becoming right now, even though it can save your life, and we talked about this on one of our future shows that's going to be coming up, is whether or not these people have the funds to pay for that, and how many times are they going to go back to the well and try to get it. The dispatchers have done nothing but been on alert for 24 hours a day, which they are anyway. 2 weeks ago, the Louisiana mayor sought to reassess the public in the state of city address that the city is figuring out how to handle the epidemic. But as soon as it leaves one city, it goes to another city. So there's a big push on prescription opiates to lessen the amount of opiates prescribed. And we have talked about the seminar that I went to a couple of weekends ago in Marymount College for Lake County, and how we are addressing that issue. But and we also talked about how they assess the price of the drug, because what is it worth to the people who's dying? Is it worth $4,500 to get a 2-pack of naloxone to save their life, and then 2 days later, after you've done that, they go do the same thing again? So just wanted to bring you up to date on opiate crisis. It has, as hard as we try to change it, something else. It's like having a heart bypass surgery. When you block the road to one source, another highway forms, and they're able to substitute another medication, and they're very inventive at finding medications. The fentanyl is 100 times more potent than morphine, and the new drug that came out that's an analog of fentanyl is 1,000 times more potent than morphine. So, and we're finding people don't know what doses they're taking. They just they're so desperate. And this doesn't have any economic boundaries. If you've seen any of the research on these places, it's wealthy as well as poor. Mostly white, actually, in these oxycodone things, and hasn't crossed the barrier like a lot of drugs have. So anyway, that's an update on opiates. We're going to talk about heart disease because this is February. It's National Heart Month. Heart disease could cost the United States $1 trillion a year by 2035. It's increasing at a troubling pace in the United States, with costs expected to double from $555 billion last year to $1.1 trillion in 2035. And this is from the American Heart Association. This isn't just something that somebody is estimating off the seat of their pants. Their new projections indicate cardiovascular disease is on a course that could bankrupt our nation's economy and healthcare system. This is just one disease. By 2035, 45% of the population, which will be about 131 million, will have at least one disease, one health problem related to cardiovascular disease. It's spreading more quickly than they ever thought it would. The last time the American Heart Association performed these calculations in 2011, they had projected that by 2030, about 40% of the United States would have some sort or form of heart disease. They were incorrect when they went through the data. In about 2015, 41.5% had at least one heart-related problem. And the American Heart Association's previous projections underestimated the impact of America's ongoing obesity epidemic, which has a lot to do with having cardiovascular disease. So we have to start taking some of this stuff seriously. The aging of baby boomers, which I'm on the beginning part of those, is also playing a large scale in the projected increase in heart disease. At age 24, your risk for heart disease is just about 20%. But by 45, the same person who has a 50% risk of heart problems more than double. So it's not surprising that 90% of those over 80 have some sort of cardiovascular disease. So the American Heart Association threw all these things into a pot and came out with some figures. And, you know, I'm not great on figures, but these are astronomical. So more than by 2035, which is in about 20 years, more than 123 million Americans will have high blood pressure. 24 million will have coronary heart disease, which is that hardening of the arteries. More than 11 million will have had a stroke. Although 9 million, almost 9 million, will have congestive heart failure. And more than 7 million will have atrial fibrillation. So we get patients in all the time that are on digoxin or Lanoxin for AFib, and then they're on a drug that keeps the blood from clotting, like Eliquis or warfarin or Coumadin, and they get confused about why they're taking them. And I had a lady in yesterday, and she wanted to know why she was taking digoxin, and I said, well, that's for your AFib, and she says, yes, I do have atrial fibrillation, and I take it for that. But she said, is it a blood clotting drug? And I said, no. And it happened to be she was on another medication that was a blood clotting drug, and she was trying to figure it out. And you've heard me on almost every show saying that we have to take the responsibility for our own medical care now and be proactive instead of reactive when something happens. So the fact that she even asked the question was relevant. We've asked you to, she said she listens to our radio show all the time, and I said, give me a call, 263-5252. If you have a call, have a question, and you think you're in your, you can remember what it is at the time, then call me while I'm on the air. And so it reminds me, I was at the STARS event on Saturday night, Paul, and we sponsor the Woman of the Year.
Yeah.
And I'm talking to one of the people that was involved with STARS, and which happens frequently when I'm in a public setting and people want to ask me questions about their prescriptions, even if they don't go to me. But in this case, I'm not sure if it was about the side effect of a medicine or what, and it happened to be a patient. And as you're standing there in the walkway, there are individuals coming by saying, "Good to see you. Thanks for being here," and likewise. And so the person says, "Well, I just needed to ask you this question." And so after this person went by and shook my hand, I said, "Well, go ahead now. What was the question?" She says, I don't remember. And she says, "It wasn't like I have to walk to the corner of the building where this came up to me when I thought about it. I'd been standing here this whole time, and I couldn't remember the question." And I said, "Well, join the club."
Yeah.
That happens all the time. So and to veer off the cardiovascular thing. So our ability to combat it has a lot to do with our asking questions and being proactive about what we can do. We will spend, just the United States, $749 billion in direct medical costs treating heart-related diseases in 2035. That's more than double the $308 billion now spent annually. Indirect costs that were tied to lost productivity also will increase by an estimated 55%. That will drive those costs up from $368 billion from $237 billion today. So on average, a worker with heart disease costs their employer nearly 60 hours and over $1,100 more in lost productivity. And that's a healthy employee. So if you're a heart disease survivor, those indirect costs are something that just keeps reoccurring. And I don't know what to tell people, as you look at, we did a brief synopsis on a radio show the other day that we recorded saying that heart disease affects more than the heart. And it also takes its toll on the legs, the feet, the kidneys, and even the brain. So I have a very good friend that just had a stroke and has, unfortunately, when you get the symptoms of a stroke, it's critical that you get into a hospital, and especially if it's a clotting stroke, you get that clot broken up. You get a certain medication within 3.5, 4 hours. But you can't let it go. Whether it's a bleeding stroke or whether it's a blood clot stroke, you have to get health care right away. This individual didn't do that. Typically men are very stubborn, all of us, to get health care because we were raised that men are men, and you don't have emotions, you don't have feelings, you just keep on plugging away. So, but the hardening of the arteries, or this plaque that forms inside the blood vessels, is something that you aren't necessarily aware of until you have a heart attack or a stroke. And what we found out is that as the plaque increases on the inside of that blood vessel, the heart has to work harder to get the blood through because the diameter of the blood vessel is smaller. And so the more narrow that artery becomes, the higher the blood pressure is because the heart's having to work harder to pump the blood through. And that's the same way when you go to treat yourself with an antibiotic for an infection and it's in the lower extremities. Because it's so far down and the heart is working so hard, it takes much longer to heal an infection, and that's what diabetics often go through. So, and the same way in the kidneys. So the size of blood vessels throughout the body are different sizes, and the smaller the diameter of the blood vessels are, the much harder it is to pump the blood through. If there's no constriction and if there's no plaque, then it's much easier. But as we begin to age, even if you're trying to keep yourself well informed about and a good diet, there's pre-existing conditions that are critical for anyone who has had cardiovascular disease, and they have to be maintained, which will also be reducing the risk of cardiovascular disease as we're moving forward. So you just have to be aware if you're obese, if you're not dieting, and you're not eating healthy, and you're not exercising, that you're going to be at risk for cardiovascular disease. Every year, more people die of heart disease than any other cause, and that's why we're talking about it so much, especially in February, because it's Heart Month. Your risk of heart disease depends on factors that are simply out of your control, like your age and your family health history, but other risk factors like smoking, how much physical activity you put out, are well within your reach and could in fact make a huge difference. So about 80% of the time that heart disease is preventable. When you're young and going and adrenaline's going and you're working from the time you're 8 years old to 80 years old, in the beginning you feel like you're just infallible. Nothing can slow you down. Even if you're overweight, you feel like you can overcome it. Even when I grew up and my family, we were on a farm and we had real milk and real cream and real butter and animal fats and everything. And I had a tendency to gain weight, but I would work as a hired man for my dad. Hired was quote unquote maybe a quarter a day. We didn't just sit around playing games from the computer or watching television. And the American Heart Association wants you to know what your numbers are, your blood pressure, your blood sugar, your blood cholesterol, and your body mass index. These four things taken together can help you and your doctor keep track of your personal risk of developing heart disease. And you need to know these four vital numbers. So if you haven't if you don't have a pen handy, we're going to take a break, and I want you to go get a pen and a piece of paper, and when I tell you what these four numbers are and what they mean to you, I want you to write them down so you will have at least a goal, a simple goal for these four numbers. So we're going to take a break, and then you get your pen and a piece of paper and write these guidelines down. It's not going to take but seconds to do it, and you will have four numbers that you need to know for your heart health for the rest of your life. Hey, all you weekend jocks, listen up. As we get into winter, workout plans change. Instead of playing softball and soccer, we're working out in the gym, playing basketball, or running on the treadmill. Use the RICE method to treat an injury right away, so on Monday when you go back to work, no one ever knows you aren't the macho guy you want everybody to think you are. The RICE method is rest, ice, compression, and elevation. Rest. For most injuries, rest the area until the pain decreases. Ice. Ice is the most effective treatment for reducing inflammation, pain, and swelling of injured muscles. Apply ice as soon as possible after an injury, even if you're going straight to the doctor. Compress. Between icings, wrap the injured area with an elastic bandage to help control swelling and provide support. Elevate. Raising the injured area above your heart to help reduce swelling by draining excess fluid. And at night, place a pillow under the area to support and raise it. North Lake Medical Pharmacy, with 2 locations to serve you, Hill Road next to Sutter Lakeside Hospital and outside the Bruno Shops Mall.
It may not require a textbook, but it's filled with valuable lessons. It may not take place in a classroom, but it's an ideal environment for learning. It may not involve a diploma, but it can help prepare California's young people for life. It's high school sports. High school sports can play a critical role in a student's overall education. In fact, studies show that students that participate in high school sports are more likely to enjoy greater levels of achievement in their academic lives. If you think high school sports are only about competition, think again. Better yet, think about attending a high school sporting event in your community. You'll be amazed by what you see. High school sports, a winning part of a complete education. This message presented by the California Interscholastic Federation and the California State Athletic Directors Association.
You, my friend, have connections in the government. 1-800-FED-INFO, the official source for all government information. And like any good connection, there's no telling where it can take you. Why, one day you're getting student loan information, next thing you know, you need job hunting tips. So whether you have information to get or ideas to give your government, call 1-800-FED-INFO. Who knows? Money-saving tips today could lead to retirement planning tomorrow.
America had just gone to war when Felipe Adams volunteered.
I knew what I was signing up for. I knew the consequences. I took a bullet to the side and left me paralyzed.
For Armando de la Rosa, the Navy was a chance to serve and see the world.
I got medically discharged in 2001.
Armando and Felipe were brought together by a unique organization that serves our paralyzed veterans.
If there was no PVA, it'd be a lot of confusion. Our training is to better the veteran. We help out with the auto grant, the special housing adaptation grant, education, prosthetics. Our main focus is spinal cord injury and disease, but we see anybody.
First thing he had asked me before he even asked my name was I being taken care of as a veteran, and I thought that was pretty good.
Changing lives, building futures. That's Paralyzed Veterans of America. To learn more, visit pva.org.
Okay, we're back.
We are back, and we are going to give you the 4 numbers you need to know for heart health. And I'll be interested, Paul, in whether you know these numbers or not.
Okay.
Because they're guidelines. They aren't hardline numbers, but they give you an idea on what to do. And the first one is your blood pressure. And what's the force? What it is the force of your blood pressure pressing against artery walls. Do you have any idea what the ideal blood pressure is now? And it's changed from
120/80.
Very good. You don't have this piece of paper in front of you, do you?
No, I don't. No.
High blood pressure is defined as 140/90, and above. Increases your risk of strokes and heart attacks. And the reason I kind of bring this up is I had a patient yesterday that went to the emergency room in a hospital, and his blood pressure was 190/95, and they just put him on a low-dose hydrochlorothiazide, which was a water pill, which, as you take the fluid out from around the body, that fluid is compressing the walls of the artery, which the heart has to work harder to get the blood through. But that's a minor adjustment, and this individual's had been up over 200, I was a little bit shocked that they didn't do something a little more aggressive. The physician labeled it as white coat syndrome because he was in the emergency room, that his blood pressure level was was much higher because he was in the emergency room than would have been at home. But he also had, which is a good thing to take with you when you go into an emergency room, and especially if you're thinking that you might have a cardiac problem or a heart problem, is take your blood pressure ahead of time and have some hardcore numbers to give the physician so they'll have an idea. The next one is blood sugar, the amount of sugar or glucose that's in your blood measured by your hemoglobin A1C and or fasting blood glucose test. Now the first one was your blood pressure, and the ideal goal is less than 120/80. This one is our 2 readings. One is the HbA1c. Any idea, Paul?
Oh, I have none.
Well, only way you would get this if you have, I'm sure your wife probably has an idea, because this figure is a new figure in the last few years. This document from the American Heart Association says it needs to be, the HbA1c needs to be less than 5.7%. Some doctors say under 7% is fine. You don't get this off your blood glucose monitor. You have to go to the physician to get a concrete number. There are some testing things out there, but they aren't very highly accurate. So this is fasting glucose, or this is HbA1c, and then fasting glucose, which is without eating for some time. This is what you would get on your monitor. Do you have any idea what that figure should be ideally?
No.
Okay.
I've never had a glucose monitor.
But does your wife take finger sticks? Does she?
You know what? Yeah, I mean, okay, so let me think here. What was good for her back? She doesn't do it anymore because she doesn't have to.
Yeah.
She doesn't take metformin anymore. Her diabetes is under control since she lost all the weight that she lost.
Sure.
But I'm trying to remember what was good. And I can't, like 108, no, that would have been high, I think. Gosh, I can't remember.
Well, ideal for fasting glucose is 126.
126, okay.
Some people go up to 600 or 700 and get in really bad trouble.
Wow.
Mine stays about 98, 108.
So 108 would have been good.
Yeah.
I don't know why that number
Yeah.
popped in my head, but that's kind of what I was thinking
Yeah.
would have been a good number.
And it kind of depends on your internal medicine doctor, what they think is ideal, especially if you have history. Diabetes is diagnosed when your HbA1c is 6.5% or higher. Fasting glucose is 126 or higher. Too high sugar events can damage blood vessels, making you more susceptible to heart disease. And so that's why that's important. Now we get to one that we talk about almost every week, and that's blood cholesterol. And that's a fat, waxy-like substance that occludes in the arteries of the veins and or in the walls of the arteries and sometimes the veins. And the less that you have of total cholesterol, and they have a good cholesterol and a bad cholesterol. The good cholesterol is HDL, and the bad cholesterol is LDL. So they would like to see a total cholesterol figure of, any idea, Paul?
Of both combined?
Yeah.
Gosh, I don't know why 70 just thinks. I have no idea, but I'm guessing 70.
Well, they'd like to see it less than 200. The 70 is probably what you're thinking about for the bad cholesterol.
Bad, you want it under 7, like around 7.
Yeah, I'm in the 70s for that. I'm in about 100 for total cholesterol, but they want to see that below 150, the total cholesterol.
Gotcha.
Good cholesterol, this is kind of a unique number because it's very similar to the LDL number, only in this case, the higher the number, the safer you are. So the LDL, they'd like to see less than 100 milligrams per deciliter. The good cholesterol, any idea? The HDL?
120, 150?
No, they'd like to see it above 60.
Above 60, all right.
This has always been a problem for me. I cannot get my good cholesterol up. I'm in
Up
the
high
30s.
enough,
And the reason is these high levels of cholesterol will block the blood going to the heart. So, and you can see the potential for a heart attack. And this is one that I never paid that much attention to, and I should, because my BMI is probably higher than it should be, and I don't know what it is. It's a measure of body fat calculated using your height and weight. The ideal goal is, I'm sure you don't have any idea.
Nope.
18,
Not a clue.
18.5 to 24.9. The excess body weight is considered, of 25 and above is considered overweight, 30 and above is considered obese, and increased heart disease risk, especially when waist circumference goes up. This is a very hard one to control as you begin to age because you exercise less. You probably eat like you used to eat, but your food isn't metabolized as quickly. Your organs aren't as efficient at metabolic rate and getting rid of foods and turning them into energy as they were, so you end up causing some fat problems. So, and it becomes harder and harder. What you exercised when you were 40 or 50 and now you start exercising, the same half hour, it just doesn't quite do it. Those four numbers are numbers that if you keep all those intact, you're doing very well. And part of the purpose is this is we're having more and more young people get these, have strokes and have high blood pressure and cardiovascular disease. One reason, mainly obesity. Another reason is they're just not eating properly as well as exercising properly. And we go back to what we've talked about for years and years, and that is proper diet and exercise will cure most stuff. But this plaque that we're talking about will build up in young arteries and may signal a heart attack risk in the early part of your life. They did a study at the University of Vanderbilt University in Nashville, Tennessee, and for the test, CT scans, which can detect those potentially deadly blockages, were performed on more than 3,000 participants whose average age was 40. Now, you know times have changed when we're considering young people, 40. Just a small amount of plaque increased the risk of heart attack over the next decade by 10%, regardless of other risk factors. However, we don't think the message is for everyone to run out and get a CT scan. Still, people with red flags for heart disease at a young age, high blood pressure, high cholesterol, overweight, or a smoker might consider a CT scan to see if you ate that you are at a very high risk. So not enough evidence exists yet to recommend routine screening at that age, but they also recommend screening patients with the known risk factors and addressing many abnormal findings. The fact that arterial or arteries, the blood, the arteries, the carrier that takes art from the heart can occur in such young adults, it reinforces the need for much younger people like teenagers to follow healthy exercise and eating habits and not smoke. I can remember when I was in high school and playing football, you got out of football practice and you went and got a chocolate malt at the little stand next to the high school, and then you went and had hamburger and fries. And of course I was an obese child until I started playing football, and I went from almost 180 to 135 all muscle, and as recent as 35 years ago or 40 years ago, I weighed 240 pounds, and gradually through all my surgeries and everything, as I'm at 180 now, I should be 10 pounds lighter. And in the summertime, when I can swim every day, I am able to maintain that. A little bit more difficult in the wintertime. But according to the American Heart Association, that plaque of cholesterol, fatty substances, has the appearance of early calcification on many factors such as genetic and diet and lifestyle. All of my family had high blood pressure. All of my family was obese. All of my family was into farming. The study references this disease in the coronary artery starts way early, way before a heart attack actually occurs. Even patients without symptoms can have an increase for heart attack, stroke, and death, which should prompt them to lower the risk factors they can control. Now, you can't control your hereditary. You can't control sometimes your environment, which we're finding out is a bigger culprit than we once thought. Just the smog and the inhalation that you take in from other chemicals. Young, healthy patients who are on the fence about taking a statin drug to lower cholesterol might consider a cardiac CT scan to see if the disease process has already begun. If it does, get on the atorvastatin, get on the statin medication. It's an anti-inflammatory to keep the blood vessels open and to keep the plaque from being formed and have the liver metabolize the blood glucose and things that are turned into fats more readily. So, and those CAT scan fees, when you're not an elderly, can vary from a few $100s to several thousand, depending on the type of scan and where it's done. So, and they're often covered by insurance, so there really isn't a reason not to have one. This report was published February 8th in the Journal of American Medical Association, and they collected data on more than 3,000 men and women who took part in it. Again, I'm a fan of studies this great because they're very thorough. They take a large amount of the population to do this, and they make it a double-blind study where some of the people, all the people in the study don't know if they're being treated any different than anybody else, but they are definitely in a group. And they're, the percent of people in middle-aged adults, 30% showed calcification of any amount, and those 12 years, 57% had a fatal. Over those 12 years, had a fatal initial heart attack or some other heart problem. So after taking into account other risk factors and treatments, people with any calcified plaque had a 5 times increase in their risk of cardiovascular problems. They also had a 3 times increase in their risk for a heart attack or stroke. So whether the amount of recalcification is high or low, it's a signal that advanced cardiac artery disease is going to happen. So as much as we don't want to think it, you know, I was watching, it seems at night when you're hungry and if you're on a diet, you get all these pizza advertisements and
no, for sure.
and Big Mac advertisements, and now they have a Grandy Mac, and
yeah, they got the 3 sizes. And
I was, my wife is on a Nutrisystems thing, so I try to find things that I can cook that are just regular things that we have at home, pork chops or lamb chops and things, and I love casseroles. I mean, I love so I went online and saw all these casseroles, and they were macaroni and cheese casseroles. There were pizza casseroles. There were things with hot peppers in them, and anyway, they all look delicious. And you look down below and you see how many calories are in one serving. It's 600 calories in 1 tablespoonful.
yeah,
And you think, and that's how I got so heavy after I got married, was we didn't have any money and we couldn't afford to buy groceries, so we would buy pastas and things like that to make casseroles out of, tuna casseroles, burger casseroles, every kind of casserole you could think of, and I loved them, and I couldn't.
Oh, yeah.
And portion size wasn't even in the program because, you would fill your plate up. This was the only food that you had, and you'd fill your plate up with this stuff, and boy, would the pounds go on. So it's pretty tough if you have that genetic tendency all the time to be heavy, and then and if you don't work out, it's I happen to love working out, and I like to swim. And the reason I would swim, I used to be on the treadmill all the time, but now I have a bad knee, a bad femur, a bad ankle, and it isn't always the most pleasant. And I don't run on the treadmill. I go through a fast walk. I'm trying to gradually get back where I can do that and endure the pain. But see, that, sounds kind of weird, but that's a pleasant experience for me if I can work through the pain and still do some good. And unfortunately, I look at it the wrong way. It allows me to cheat. If I exercise,
sure. Yeah.
And I know I put in a good half hour to an hour, I can go up and eat a piece of pizza. But normally I can't do that. I can't. I'm one of the people that that's probably my favorite food, and we purposely don't get pizza because we both love it. And, it's my food of choice. So, well, we're going to switch tracks here a little bit, and because we have a basic older population also, and there's a sharp rise in people that are living longer using multiple what we call psychotropic drugs. The number of retirement age Americans taking at least 3 psychiatric drugs more than doubled between 2004 and 2013. Now remember, when we talk about psychiatric drugs in this kind of venue, we're talking about antidepressants, we're talking about sleeping pills, we're talking about painkillers, and we're talking about antipsychotics. And previous studies have found that this new report captures one important dimension, the rise in so-called polypharmacy. And what polypharmacy is taking multiple medications and of 3 drugs or more in the primary care where most of the prescribing happens. And the early research has found that elderly people are more likely to be on at least one psychiatric drug long-term than younger adults, even though the incidence of most mental disorders declines later in life. And the professor that did this study at the University of California in San Diego said he was stunned that all the talk about how polypharmacy has been for older people has doubled. The research team focused on office visits by people 65 or older that resulted in prescribing at least 3 of the psychiatric sleep and pain medications like Valium, Prozac, OxyContin, and Ambien. It found that the overall number of those visits increased to 3.68 million in 2003 from 1.5 million in 2004. Nearly 150% increase, and that was partly because the population is aging, but mostly because of an increased percentage of prescribing multiple medications. And this is not surprising. The largest jump, the biggest jump, was in rural areas, which suggested that the increase partly reflect doctors and patients falling back on medications when they've had little access to other options. So like speech therapy, massage, or relaxation techniques. Increasingly in a rural area, there's less and less of those available, and so they treat them with medication. They also issued a strong warning to consumers about the risk of combining Xanax or Valium with pain medications like opiates. But the analysis found that people taking the opiates were about as likely to be on at least 2 other drugs as those not taking the strong painkillers. So we've talked about this before. It's called an opiate cocktail. And the Drug Enforcement Agency is not happy to see people taking oxycodone or hydrocodone and a anxiety medication like Xanax or alprazolam, and then taking a sleeping medication or a muscle relaxant, as well as maybe a tricyclic antidepressant. There's a particular worrisome pattern that suggests some inappropriate prescribing. One possible solution would be to give patients and doctors greater access to alternatives like psychotherapy and stress management. Only 10% of those visits included one of these options. The seminar I went to a couple of weeks ago on Friday, I met several physicians, and this was an issue that came up. And these are local physicians that I work with at the hospitals, both St. Helena, Clear Lake, and Sutter Hospital here in Lakeport. And some of them weren't aware of what the issues could be with treating the elderly. And there's a criteria that that we deal with in skilled nursing facilities, and now they're applying it to other forms of office practice called the Beers criterion. You've heard me talk about it before. I'm in the process of trying to condense that and get it to physicians so they will know before they prescribe a medication to an elderly person what is going to come up as a absence of a star on your star ratings, because you're rated as a healthcare practitioner, both pharmacist, pharmacy, hospital pharmacy, and physician, on whether or not you're giving these people medications at age 65 or older that they really shouldn't be getting. And the reason they don't want them to get this medication is they are central nervous system depressants. They slow down the activity of the central nervous system instead of speeding it up or keeping it at the regular rate. The reason is that's how they function. I mean, if you have a diarrhea, you need something to slow down the motility in the intestinal tract. If you have some sort of sleeping problem because you're stimulated too much during the day, you need something to slow down that brain so you can function. If you are on some kind of, you need to be on an antidepressant medication. Although they increase the epinephrine and the norepinephrine, those feel-good type chemicals that make you undepressed, they also slow down part of the central nervous system that stays active most of the time. So and plus you can get into a thing called serotonin syndrome where they're getting so much serotonin they go the other direction. So as people age and physicians have to get more and more involved, part of me bringing this up is one of the physicians came up to me, and because I mentioned at a luncheon that our biggest problem is being able to communicate with the physician and tell the physician about the medications that are having a negative star rating. And this physician said, "Can you get me the information? I would really like to know." And their biggest problem is if you don't want them to have that medication, what's the alternative? And many times there isn't an alternative. Even if it's an over-the-counter medication, can be on that Biersch criteria list that, for example, Benadryl for sleeping, you can use it for 7 days, and then beyond that it becomes a negative thing on their medical record. So life's become very complicated when it comes to treatment now. More and more regulations, more and more things that they said you can do that you can't do. And it makes it more difficult to treat a patient, especially when you only have 10 to 15 minutes to do it. So we want to remind you that to have a great weekend. The Polar Plunge is this weekend for Special Olympics, and it's going to be at Kelseyville Park because the county park is underwater. So I'd like to remind you we're North Lake Medical Pharmacies with 2 locations for you at 5136 Hill Road East across from Cedar Lakeside Hospital. Call us there at 263-6192. And outside the Bruno Shop Smart at 347 Lakeport Boulevard, call us there at 263-1328. Thank you, Paul.
Thanks, Bill, and we'll see everybody back here again next Wednesday for Health Talk right here on AM 1270 and 96.5 FM KXBX Lakeport,